This is Global Health, and I'm Gail Fraser. This is also Unit 8, Part 1, and we're going to be talking about HIV/AIDS today. So our topics include the linkage between public health and human rights. So we've been talking about that as a theme throughout the course. Now we're going to be thinking about human rights and people living with HIV. We're going to examine the human costs of HIV/AIDS because you have to remember the people that are affected are young adults, and those are considered the most productive contributors to our societies. So if they are not well because they have HIV, it's taking out the heart of our population and its productivity. We're also going to be doing a case study. We're going to be looking at Latin America and the Caribbean because there are some dramatic contrasts between the successful programs in HIV here in Colombia in comparison to Guyana or Trinidad or Jamaica, which have serious problems with HIV. But first, let's talk about what was happening in the Olympics. I have to give compliments to Trinidad and Tobago because Mr. Gordon was tremendous. He was a bronze medalist in the Olympics, and he's from Trinidad and Tobago. And the reason I mention this in particular is because my family, we lived in Trinidad for 5 years, and my husband is Trinidadian. So some of my kids have dual citizenship, and we are very proud of Trinidad and Tobago. But we are not proud of them for their HIV rate. So we also can't talk about Trinidad without talking about Colombia. Of course, you had some Olympic medalists from Colombia. Here are some of the women that were successful in getting bronze and gold medals for Colombia. And of course, your bronze medal from the competition here. But today we're really going to be focusing on people that are living with HIV and how they can continue to get the health care that they need, the medications they need to be productive members. So we're talking about public health and human rights, or basically the right to health, and people living with HIV. I want to encourage you to go ahead and look at the PowerPoint that's called Fast Track to United Nations, and it has to do with HIV prevention. I'm not sure if I click here whether it'll come up. Yes. So this is the fast track for ending the HIV epidemic, and it is talking about making a huge effort, providing a lot of funding to dramatically reduce the number of people with HIV by providing adequate medication, access to health care, and continuing efforts at a higher level in more places around the world. We just flip through this slide. Now, I won't go into this slide deck in detail, but I want to encourage you to take a look. They have a lot of information here about the problems we have with HIV. Let's go back to this slide. You can see that primarily it's in sub-Saharan Africa, but we also had serious problems in Southeast Asia, some places in Latin America as well. They're talking about the number of cases or the number of people that are on antiretroviral therapy, number of children who have received it, meaning though probably as they were born, they started them on HIV. And these are the costs, $19 billion. So again, it's not just a matter of getting the medications and all the logistics of reaching populations and increasing awareness about HIV. It's also a dollar sign on it too, for all of these things cost money. I'm just flipping through this because I want you to take some time to study, but this is the slide I really want you to look at. New HIV infections in low and medium income countries. So these are all developing countries, and these are predictions of where the rate will be in red if nothing is done, and the rate that is in blue here would be if there is in the fast track UNAIDS intervention is carried out. But you can see it costs a lot of money, $21 million here. So this is an overview that is very dramatic. So you can see in Eastern and Southern Africa, the dramatic decreases if fast-track interventions were paid for, if we had funding. And this has been a barrier all along because of the immense expense and the long follow-up. Because when you have HIV, it's very much like having any other chronic illness, diabetes, hypertension. You have to take medication for the rest of your life. And so the same thing with HIV. So you can see the dramatic decreases that they are predicting if they use the fast track method. Let's close that. So we can go back. Okay. So please go ahead and look through that slide deck that's in the website for you on Virtual Savannah. Let's talk a little bit about the universal human rights. If human rights and democracy is the only in the underground that we fight for human rights, we will never get there. What are they talking about? This is a professor from Columbia University in New York City. If human rights and democracy is only in the underground that we fight for human rights, we will never get there, meaning it has to be mainstream. It has to be more and more people that are committed and dedicated to working for universal, that means for everyone, human rights. It's only when all people know about their own human rights that democracy will truly be a functional system. And also, as an example, in some countries, only about half the people even vote. And that's because they do not see voting as being a human right, that they are not taking advantage of that way or the outlet to be politically active. So the people's movement for human rights learning. So again, it's a matter of informing people that they have choices they can make. And this is her contact information. It's my aspiration that health will finally be not seen as a blessing to be wished for, but as a human right to be fought for. So again, passively sitting by and say, oh well, is not going to get it. We need communities that are resilient. We need communities that are saying, yes, we need this, we need access to health care, and insisting on it, but also helping and contributing to the planning that it takes to get there. This is Kofi Annan, and he won the Nobel Peace Prize in 2001. He was the head of the UN for a number of years. So let's look back at our Millennium Development Goals, and we're looking at this year and beyond. So goal number 1, eradicate extreme poverty and hunger. We were looking at the relationship between poverty alleviation and global health last unit. Goal number 2, achieving universal primary education. So people that are informed about what their rights are, what human rights are, and that they have them, that they need to fight for them, that is important. So that's the second Millennium Goal. Goal 3, gender equality. Girls and women should be treated the same as men and boys. So we need to strengthen or empower women. Goal 4, reducing child mortality. So protecting especially children under 5 years of age. Improving maternal health, because women who are mothers also protect the children. So it's important to protect the women. Combating HIV/AIDS, malaria, and other infectious diseases, including tuberculosis. That's goal number 6. 7, ensure environmental sustainability. I think that with climate change, this is becoming a more prominent goal, something that's receiving more attention. And then number 8 is to develop global partnership for development. So we were talking about economic development supporting livelihoods, which then in turn alleviate poverty, which then in turn improves global health. So it's a kind of a stage. If not now, when? And if not you, who? So again, I'm trying to encourage you, motivate you to say, yes, you will be a global health champion, that you will work alongside with an NGO or humanitarian organization. The International Federation of Red Cross Red Crescent is an excellent organization to work for, to volunteer for at least a few years. The linkages between health and human rights are very clear, and these are some examples. It's from the WHO document that we looked at earlier in the semester related to questions and answers about human health. So here it is a little bit bigger. We're talking about harmful traditional practices, human rights, the right to health, the right to participation. So that's the social engagement that we were talking about. These are all interlinked to health and human rights. Examples of these complex linkages: violations and lack of attention to human rights have serious health consequences. Health policies sometimes violate human rights. I think Venezuela would be a good example. They have it on the books that women and children are protected, yet it's just not happening. There's no enforcement of the law, even if the law is there. So it takes more than just a policy. And then, okay, the impact of vulnerability on health can be reduced by taking steps to respect, protect, and fulfill human rights. So there are very close linkages between health and human rights. For more than 10 years now, governments of Norway and Sweden have had a very important role in setting a high standard for international relations as well as families. And I think that one of the, they are our leaders in guiding, and violence against women with HIV is very prominent in many countries. It's one of the things that makes me sad, because HIV initially was identified as primarily an illness of homosexual men. As the virus became more prevalent among men, heterosexual men, women started to have HIV from their partners. And women are more vulnerable to HIV just because of our physiology. We are allowed to have contact with the virus longer so that it is more likely to infect women, although men are infected. So it's hard for me to understand why men accuse women of spreading it, when in truth and in fact it's the other way around. And because men have multiple sexual partners, it gets spread to more than one woman to several women from one man. So the Pan American Health Organization, again working throughout Latin America, Central America, Caribbean, they're usually utilizing health as a bridge to create long-lasting peace. And it's a cornerstone of the Pan American Health Organization within the international community to look at prevention of violence against women, especially women with HIV. Health and human rights, you can see that the number of victims for violence is huge. And by this map, you can see China stands out, also Nigeria, because Nigeria is not only a Muslim nation primarily, but it also tends to be very patriarchal, so women have few rights. You can see the lighter areas here, Afghanistan, Pakistan, Thailand. So these are all number of victims for strategic health assessment in violence against women. Despite these advances, there are too few efforts to raise awareness of this problem, and that there lacks a consistency in policies and enforcement. Sometimes when women's rights are violated, nurses and doctors and different people just say, oh well, she must have put herself into harm's way. And I think that that really needs to change. We need to have a better attitude toward protecting women and children. Let's stop there. This will be the end of part 1. We're going to talk a little bit more about HIV and human rights in part 2. Thanks. This is Global Health, and I'm Gail Fraser. We're talking about Unit 8. This is part 2 of our discussion about HIV. In the 25 years since the HIV/AIDS pandemic has started, more than 25 million people have died. These will be men, women, mostly your age or maybe a little older, and their children. Today it's estimated there might be as many as 40 million people with HIV/AIDS, so it's still a huge global health problem. Each year another almost 700,000 children are infected with HIV. In sub-Saharan Africa, HIV/AIDS has dramatically reduced the overall national life expectancy, and 15 million children have been orphaned because their parents have died. As a matter of fact, they were trying to organize systems in South Africa, other sub-Saharan African countries, where the elders in the community that are survivors to take care of not only their own grandchildren, but adopt some of these orphans that don't have anyone to care for them, and was creating a new, different type of family as a response to this crisis. HIV is closely linked to women's rights and their rights of privacy and confidentiality, so the voluntary counseling and testing, so VCT, is very important. This woman is HIV positive. She has been taking medications. She's confirming that her little child is also continues to be HIV negative, so she's doing some testing. They'll do a little finger prick, and they'll make a blood blot, and they will send it for testing for HIV. Hopefully the child will remain HIV negative. HIV/AIDS is a shadow over the whole continent of Africa. It's a public health #1 problem in the 21st century, and includes the evidence that some women need to be protected. Why is HIV related to women's rights? Well, the confidentiality is that she has to be able to, in her own time, tell her partner or her husband or family that she's HIV positive. And sometimes that has very negative consequences. So she might even be tempted to refuse HIV testing by opting out because of the stigma and the discrimination that she may experience from communities that don't understand that HIV is something that she got by accident, maybe from her own husband, and the consequences can be greatly misunderstood. We need to protect with informed consent when we do the voluntary counseling and testing, that she would be given and treated just like anybody else in the clinic, so that there wouldn't be any way someone could guess that she was HIV positive. Because again, she needs to have the right to tell her family in her own time and be able to be prepared for the possible consequence of domestic violence, whether she might even be abandoned at that time. And it does seem unfair because the woman probably got the HIV infection from her husband. UNAIDS reports that a lot of health services are needed for people with HIV, so we have to respond effectively to their increased needs. They also, when you have HIV, you have a higher metabolic rate, just like when we have a fever, when we have the flu, it's an infection. And so children and adults that have HIV actually need more food than others. We have to have strengthening the public health functions and make equitable health services available. They needed to be treated with respect when they come to the clinics, and that's a big problem with stigma, even among healthcare workers. Sometimes they're the ones that actually are the reason why people don't seek care. So again, we're going back to the basics of human rights and combating discrimination because of the HIV pandemic. Providing access to treatment is also very important. Before, when you did HIV testing years and years ago, people didn't want to be tested because there was nothing they could do about it. It only had negative consequences. Now, if you're tested, you can get treated. So the combination of testing and then potential treatment with antiretroviral drugs has encouraged more people to be tested. Healthcare treatments are rather based on need. So again, the cost for the drugs was very high. Initially, they didn't think they'd be able to pay at all for all the costs associated with giving HIV drugs, for keeping the viral load below a certain level. They now have made a generic drug available, and I think that even that should very often be given at no charge at all. The programs include HIV/AIDS care and treatment for advanced AIDS, linked to, again, get tested, get treatment. These are the things that we want to encourage people to do. Let's just look at a video.
I'm a woman living with HIV. I'm a mother and grandmother.
Good morning. Today is 11 November 2011. We are filming in Hanoi, Vietnam.
Every minute, in every corner of the world, people are working to make sure that services could be made available. And we want to capture their energy, their passion.
In 2008, I decided to get tested for HIV, and I found out I was positive.
I've been diagnosed with HIV for almost 21 years.
We leave at around 5 a.m. and find that when we get to the clinic, there are already over 300 people waiting.
The clinic is only about a 10-minute cycle from my house. There's no real hassle for me getting to the clinic. I'm alright.
In the mountains, the roads are not so good. The Lesotho Fly doctors, together with Partners in Health, really helped the HIV-infected people in this area. The medications, the equipment, and the supply can be delivered on time to the patients.
This is Dushanbe, the capital of Tajikistan. The time now, it's 11 past 11. Today we are going to film civil society organization which is based in Tajikistan.
Next, I don't know if you can help me. We are offering those services, a family planning included.
How many months pregnant? 6 months. Hello, my name is Pastor Sirah. We're at the New Start HIV Testing and Counseling Center in Harare, Zimbabwe.
It's 11:30 and we are having a counseling session with the youth.
Utiliser le choix. Vous voyez les petits mouchoirs là, le mettre en contact.
I live in the UK. I've got access to everything that I need in order for me not just to live a kind of physically healthy life, but an emotionally healthy life.
When I began taking ARVs, I noticed that I started getting better.
At the moment, we have a good team. I'm sure we are providing reasonable service to patients who are living with HIV and AIDS, but still there's a scope for improving the care.
I've been living in the camp since January 12th. We don't feel secure here because there is a lot of crime.
El machismo nos está matando.
Today is 11.11.11 and we're filming at the Rehabilitation Center of IDU users.
This is Global Health. I'm Gail Fraser. This is Unit 8, Part 3, and we're going to be talking about AIDS hospice care. The three components for a successful HIV program is focus on women's health, because women are more likely to interact with the healthcare system because they're bringing their children to get immunizations and other types of activities. We have to do more active case finding, meaning that if someone is identified with HIV, then all of their sexual contacts need to be tested. And again, we need to look for other secondary conditions that people with HIV tend to have. They're more vulnerable to infection since they have they're ill with HIV, so they're more likely to get other types of infectious disease, even unusual types of diseases like fungal diseases that normally our bodies can fight against. Well, their immune system is suppressed, and so they are more likely to have different types of infectious disease as well as different types of characteristic cancers. So again, silence, you can see here at the top here, silence is actually our enemy for the cycle. If you are silent and then you are ignorant, you have fear, that creates stigma where you are discriminating against someone just because they have HIV. So it's a very vicious cycle. We have to learn to break that cycle. HIV treatment is very often difficult because it's happening primarily in sub-Saharan Africa, where they have very high rates, but also in the Caribbean in low-income settings. So you have less quality health care services that are being provided, and few people can actually afford even the transportation to get to the clinic. Never mind the care could be free, but they still can't afford the $16 bus fare that it's going to take them to get to the clinic. So what they have decided that might be a more effective strategy is to create wellness centers. And that's one of the things, the activities for this particular unit, is that we're going to actually create a wellness center, make a choice about where you'd have the next the Voluntary Counseling Center, so VCT site, as well as consider having a wellness center. They're decentralized, they're close to the communities in which they serve, and it has a very positive impact on communities because you're thinking of continuing to be well, taking your medication, eating good diet, having a healthy lifestyle is even more important if you're HIV positive. The humanitarian assistance is often, historically, it's not even analyzed. So unfortunately, a lot of aid goes in, like the Tsunami Recovery Program that I work with for some time. You had $60 million over 5 years. That's a lot of money. But sometimes it's not easy to track exactly where that money goes. Some of it is lost. And so as humanitarian assistance goes on, we need to have a global strategy for actually preventive health so that we won't be doing so many, putting out fires where there already is an infection. Let's prevent it before it happens. Prevention is always more effective than treatment. Health service research findings provide baseline knowledge for the implementation of evidence-based assessments. So again, we need to be looking at ways that we are tracking and finding out which is the most successful models and how we can be more resource conscious to make sure that the few resources we have can go further. We need to maximize our coordination so that there's no duplication of efforts. So there's a lot of things that we're focusing on because of the enormity of the public health problem that HIV/AIDS presents. HIV prevalence in Germany is among the lowest in the world. Why? The educational level is high, people are more conscious of HIV. And again, they have human rights-based approach to dealing with HIV. There's fewer discrimination. HIV happens. It's not because you are a bad person or you contacted the virus. And it might be very benign. You may have received a blood unit that had HIV or some other type of contact. So again, there's fewer discrimination in Germany, so it allows people to get the care and treatment that they need. In addition, Germany has a response that focuses on awareness creation, behavior change, and creating an enabling environment, encouraging people that they will not be discriminated against, encouraging them to go ahead and attend the clinics, legal barriers for introducing harm reduction measures. Again, injecting drug users, so IDUs, they have they share needles, they are much more likely to be HIV positive. So again, they have different ways of allowing people more freedom to get clean needles, do different things so that it has a positive impact on fewer people are getting HIV, fewer people, HIV or hepatitis C is another one that is very common among injecting drug user. The overall average adult HIV prevalence in Central and South America is estimated to be 0.5%. It's just about the same as Canada and North America. And so Colombia average adult HIV prevalence. So this is very, very good. Colombia has a fairly low rate of HIV. Why is it uniquely different than its neighbors? Ecuador, again, prevalence is very low. Venezuela is a little bit higher, probably because of fewer people being able to access health care because of all the civil disruption and disruption of healthcare systems in Venezuela. Brazil, look, very, very low. Peru, prevalence 0.5. And it's interesting because in Guyana, the prevalence is very high. And they always blame it on the Brazilians, that they're coming across the border. Well, in truth and in fact, it is absolutely not true, because you can see Brazil has a very low rate of HIV. In contrast, the overall average adult HIV prevalence in the Caribbean is 1.2%. That is much, much higher. Bahamas, 3%. Guyana, 2.5%. Jamaica, Trinidad, so almost 2%. So they're very high, dramatically higher. And I think that this is true of all the Anglophone or former British colonies within the Caribbean and Latin America. So Guyana is one of them. The cultural systems are there different, but look at Cuba. Access to healthcare awareness is very high. So Cuba is the prevalence is very low, which shows a contrast between the cultures and access to healthcare. Latin America region, we've got almost 2 million people living with HIV/AIDS, and that was in 2009. Of these, about half of them, more than half of them were newly infected. So that's a warning sign. And an estimated 60,000 people have died from HIV/AIDS. In Mexico, an estimated 220,000 people are living with HIV. These are 2009 numbers, so hopefully they've stayed the same or maybe not gone up very much. In Mexico, an estimated 21,000 people have died, so about 10% of those. Living with HIV and the right to health and the equal treatment is what we're really concerned about. So you can see we got the healthcare is a human right attitude where if you're found to be HIV positive, it's better for you to community health to take care of you. Undiagnosed HIV, an unknown death sentence. So again, we mustn't be silent. We must move forward. It doesn't have to be an undiagnosed death sentence. Care and treatment really works, It's a commitment that people make to taking the medications. They take medications several times a day, every day, for the rest of their life. But they gain weight. These individuals are productive. The healthy individuals, as long as they keep the HIV viral load low, they're also less likely to spread the virus if they're taking their medications. So again, these are all win-win kinds of combinations. It's when discrimination makes people feel, oh, I'm not going to go to the clinic. I don't want to know if I'm HIV positive, that they're continuing to spread the disease, as well as not getting the care and treatment that they need personally to maintain their good health. So these are our questions. Human right to health, and enforced by the United Nations, but it also includes people living with HIV. So I want to encourage you to go ahead and do your reading and answer questions related to how you feel, the right to health, and how it relates to people with HIV. Because there are laws that people mustn't use HIV as a weapon. They're threatened to, I'm HIV positive, I'm going to bite you, or I'm going to throw blood on you, or, they actually have legislation on the boards where people have a very mixed feelings about, well, they're HIV positive, shouldn't they be treated differently? And the answer is no. We need to treat everyone the same, and that's why they have universal precautions. So you don't know if a person coming in has hepatitis or hepatitis C or HIV, so you're using gloves, you're treating them exactly the same as if they were HIV positive. So there shouldn't be discrimination in the healthcare environment or in communities. They discuss the impact of stigma and people that are most at risk for HIV exposure. And also consider our case study where we're comparing Ecuador and Germany and Colombia, where the rates in Colombia and Ecuador are fairly low, but not as low as the lowest in Germany. And why is that? Is there more access to health care? Is there more, the idea that Germany uses these behavioral change and awareness interventions to encourage people to treat HIV with any other type of infection or chronic disease. So let's go ahead and watch the closing video.
Let me just take a moment and just stop and think. 10 years in. $7.7 million people are alive because of the Global Fund.
But in 2000 and 2001, the rich countries were just letting everybody die.
We were fighting the equivalent of a civil war, but one without guns. The fact that people could buy life made it very, very painful.
Now, there was an accident of geography. Longitude and latitude, where you were born, decided whether you would live or die.
AIDS, of course, was increasing. Tuberculosis was not dealt with, and malaria was a scourge that was there, and very little was being done.
When I was president, and for the years before, there was a sharp global divide between the countries and citizens who could afford medicine and those who couldn't. The world had no group that could figure out how to stop the AIDS emergency, and yet it felt like the only way we could get all the resources together to help the people, particularly in Africa, who are suffering from these terrible diseases. Action!
I got HIV when I was barely 18. I started treatment when I was 30 years old. I'm now 40 years old, and I hope to live maybe another 30 or 40 years.
If people get out on the street, if they march, if they get organized and get busy, they can accomplish amazing things. Things don't have to be as they are. The world is more malleable than you think. You can kick it into shape. You can kiss it into shape.
The main thing was to have people realize the centrality of health in human development, and therefore in any nation's development.
Okay, we just wanted to talk about one more thing. Since we've just are completing Unit 8, and we're 1 week away from the Easter break, so you have Santa Semana next week, or 2 weeks from now. I think that it's important to review the project. And I know that it's going to be a lot of work for you to choose your group and so on, and so I want to give you a lot of advance preparation time for completing your international project successfully as a student group. So let's go back to looking at the syllabus. So remember, we're still having our Global Health Adventure. Now, I know that it is work, but I'm hoping that it has been different than your other classes, not just because it's an online class, but because it is interesting in different kinds of ways. You're looking at information about communities and health, and the differences when you get away from Bogota, even within Colombia, is tremendous. So it's intended to be an adventure. We had talked about the fact that the world we want, it actually is a foundation that supports youth organizations to make positive changes within their own community. So it actually offers money to sponsor humanitarian or charitable activities, like some of the projects that you could do, garden projects or other ideas that we may be doing here in Unisabana. So I'm hoping that you might be interested in joining this, the World We Want Foundation, and even applying for a grant to do a project. Another organization that does this is Futures Without Poverty. So this is a group that the nursing students will be starting probably this semester. We are working with them to form a chapter of Future Without Poverty. We have a right to survive. So those are some of the global health challenges, and the fact that we need to be adequately prepared. We can't just say, oh, it's a disaster. Oh, we didn't know it was going to happen. Climate change is here to stay, and it is going to happen, and it is our responsibility to prepare better so that we'll have fewer negative impacts from the disasters that are happening. We have upstream global health challenges. So you have your 8 missions and the different things that you will be doing as part of your assignments for developing action plans and really being creative in trying to come up with solutions, because no one has all the answers. And very often, my students have come up with really good ideas that really could be followed up on and actually actionable. So upstream public health, they have innovative solutions, community participation, which is very important. You won't move forward with an initiative without your community giving you input about what they really need, and advocates for health equity. Of course, we've been doing Half the Sky, so there are actually 8 different levels. And to tell you the truth, I've only done to level 4, so I have some extras to do as well. I don't have a Windows 8 machine, so I have to borrow one in order to do Half the Sky. But I've found it to be time-consuming as well as interesting. So I'm hoping you will continue to work on that. Your global health missions, again, simulation activities, program planning, the types of things that we're going to have at we've already had in the first half of the class, and we will continue as we complete the 16 weeks or 16 separate units within global health. Of course, our global health challenge, and then just the idea that we had an unexpected event where the Ebola infection started spreading throughout all of West Africa. normally is only restricted to Central Africa, say Uganda, and Central Republic, Democratic Republic of Congo. Then it has gone into some of the rejoining areas like Gabon and the eastern side of Nigeria. But this has been far, far worse than ever before. These are unexpected emerging diseases. And of course, we talked about the link between geography and health, the identifying potential positive and negative impacts of health policies. So we put up a hydroelectric plant. Remember, we were talking about Paul Farmer mentioning this is a great economic benefit, but then it displaced all those people who normally farm in that area where it filled up with a lake because they had put a dam. So there are consequences, negative and positive impacts. And we are also defining the role of public health practitioners within the global health environment. So these are all things that we have been talking about. We looked at public health and human rights. We looked at the relationship between health equity and in an international setting. We reviewed strategies about human rights and the right to health. So let's go over the actual global health priorities. And so again, we have a worldview of global health. Now, we have Sustainable Development Goals, and this is part of the United Nations. And within the United Nations, there are lots of different organizations. And one of them is the World Health Organization within the United Nations. And they're looking at sustainable development and solutions. These are a whole network all over the world with ideas from people that are studying or working in India, with people that are working in France, that are working in South Africa, put their ideas together to come up with ideas for solutions. We previously talked about the United Nations, World Health Organization, Millennium Development Goals, so MDGs, and those extended until this year. So now we have the 2015 and beyond Sustainable Development Goals that actually we are still working on. They are trying to decide what they should be. Right now is a very long list of 17 different things, these Sustainable Development Goals. When they finally make the decisions, that number may reduce, or they may combine some different ones. But we look at global health priorities. Number one, end poverty in all forms everywhere. End hunger, achieve food security. See, this is now being emphasized. Improve nutrition and sustainable agriculture. So they have modified from the Millennium Goals now to these Sustainable Development Goals. Number three, ensure healthy lives and promote well-being at all ages. So again, these are slight variations from the previous goals. Ensure inclusive and equitable quality education. So that's number four. Number five, achieve gender equality and empower women and girls. Number six, ensure the availability and the sustainable management of water and sanitation for all. It's absolutely possible. Clean water for all. One of the students that I was working with this semester, she actually just graduated from University of North Texas, and she has this great idea of doing a clean water initiative in her home country of Nigeria. And it's going to start off small. She's being really smart about just going for a pilot study. They're going to evaluate the water and try to create an initiative just in her own neighborhood. And from there, expand and expand. Hopefully, eventually with their success, that they will be able to nationalize clean water for all in Nigeria, because it's absolutely possible if they put resources toward it. Again, more global health priorities. Number seven, ensure access to affordable, reliable, sustainable, modern energy. Yeah, because when you try to create energy by burning wood, it creates smoke, and it deforests the deforestation where they cut down all the trees. This is what's happened in a lot of East Africa. I worked in Tanzania for a couple of years, and it's just there are no trees, and there are no birds, and there's a consequence. or the whole cascade of problems. Okay, number 8, inclusive, sustainable economic growth. Number 9, resilient infrastructure. 10, reduce inequity within among countries. So why should Colombia be so rich, yet its neighbor in Guyana be relatively poor or not developed? Number 11, make cities and human settlements inclusive, safe, resilient, and sustainable. Number 12, ensure sustainable consumption and production patterns. Number 13, take urgent action to combat climate change and its impacts. And then we skip right down to the last one, 17, the means of implementation and revitalization of global partnerships for sustainable development. And that's one of the things that I'm very much involved with now, sustainable development. So let's look again, focusing just on your evaluation. You've got a group country project. Now I want you to find 2 other students to work with, or 1 other student, or you can work independently, but it's a lot more work for you. So at least 1 or 2 other students form a group. You pick 1 country, 1 global priority, and then you present a project. On the 15th of May, it'll be due. So that you've given you a good timeline. You've got 6-8 weeks to go. So choose a group. Here we are. Even our dancers would be good ones. Choose a country. There are, 427 countries in the world, so choose a country. Choose a topic. So one of the global health priorities. It can be infectious disease, it can be non-communicable disease like smoking cessation, it can be any of the priorities. So you can choose something about Ebola. Hopefully we'll only have 1 group choose Ebola, and I will, if they do, then Sierra Leone and Ebola would be an example, or Liberia and Ebola. I would prefer to only have 1 group do Ebola, and only 1 person do an individual country. So to choose a topic, it's easy. Look, you just look in the newspaper. Here we've got Iraq launches assault to recapture Tikrit. So, or the fact that they might have Iran developing nuclear war. These are huge, potentially disasters. The impact of war and the impact of nuclear arms. Reducing maternal and child deaths. So again, increasing child health. Here's an example from my colleagues that I saw on Facebook this morning. So they're working on training more midwives. Here's the newspaper from yesterday. Of course, I'm in the Middle East, so the National Hero is talking about the stigma of HIV sends patients overseas. So they go for treatment outside the country, so people in the country won't realize that they have HIV. Women learn to live with AIDS stigma. So these are women that are in Saudi Arabia that have HIV. And so, again, they are not well thought of, although they do receive care. Here's a news from the Globe. It's straightforward. It talks about Haiti. So here's our article about Haiti. It says 5 years after the devastating earthquake hit in Haiti, the nations have made great progress in rebuilding public health systems, the Centers of Disease Control and Prevention announced in January. So again, you can look up things that are in the news. Anything to catch your interest. This one caught my interest because it's here. Get the article. The Dubai, United Arab Emirates, not so necessarily Dubai itself, they gave $114 million for aid that went to the UN. So it says that a relief stockpile increased 35% last year with growing demands for humanitarian emergencies around the world. So these are the types of things that you are free to look at for your project. So step by step, you form a group with 2 or more students, you select a country, you select a topic, and then you prepare a slide deck of about 30 slides, not more than 30. I want you to spend about 20 minutes, 30 minutes tops for your presentations. And then, of course, your bibliography. And you've all been doing very well on the bibliography. Introduction, so your Millennium Goal linkages or your Sustainable Development Goals, 4 examples of health programs, 4 examples